It's the least invasive procedure to our natural teeth to replace teeth. If you have to take 2 healthy teeth and cut them down to pegs in order to replace 1 healthy tooth, now you have 3 unhealthy teeth, right? And if you can replace that 1 tooth with 1 false root and not touch the other teeth, think about your lifetime. The actual implant is a root replacement. So if a root of a tooth or a tooth is missing, we want to place something in bone to actually allow us to place a tooth on top of it. I want people to know that implants are a lifelong solution for replacing missing teeth. The candidates for a dental implant can be anyone from my son Jake, who at 17 was playing basketball at Ignatius and got his tooth knocked out. Instead of cutting 2 healthy teeth down to do a permanent bridge, we elected to put in the implant to replace that root. And if you could see his result in his smile, you wouldn't even know that he has it. A child at 18 may need a dental implant, all the way to a patient who I treated was 90 years old, who didn't want to have a denture. And again, we actually gave her something permanently in place in 1 day that she could eat and chew with. You go from eating fibrous foods, healthy foods, things that you can eat and chew, to softer foods. What does that do to your overall diet, your nutrition, your health? With dental implants, we can bring you back to 95% of the original chewing ability.
I didn't have good teeth, and I had partial also, and a bridge and everything possible. And you know, if you have something what is removable in your mouth, you don't like it. And you don't like it when you talk, you don't like when you smile, when you chew. It's never so strong that you can be sure that it's not gonna fall out.
She actually went from, loose teeth, intimidated to smile, very hard to eat, to, a dentition those teeth being removed, implants being placed. That was all done in 1 visit. Now she has the ability to smile, speak, eat. I think she has self-confidence back. Her self-esteem, she feels better about herself. I think all of these things are irreplaceable when you think about what you do for the patients that are suffering with these problems.
My new smile has provided me renewed self-confidence and many, many compliments from my family and friends.
I just happened to be at a business meeting and bit into a roll, and my tooth split in half. And Dr. Aerni basically explained to me that we could do root canal, try to save the tooth, and go that route. But there was other considerations as far as lowering the jawline. At the end of the day, I asked him, "What would you do?" And he said, "Well, if I were you, I would get an implant." I consider him a friend. So when he said I probably need a dental implant, I knew it was the right choice for me.
They want to know, is it going to hurt? And I can tell them absolutely not. It's not going to happen. You're going to be comfortable. We're going to make sure that you're comfortable through the whole thing.
Dr. Aerni made sure to have everything really comfortable. And the morning of the surgery, I took some other medication that he prescribed, and no pain, not at all, no.
In order to provide the care that I want to give to my patients, I have to present myself in a way that allows a patient to feel like I'm in the right place. When I designed this office, I went to probably 20 different offices. I wanted an office when they walk in the front door, a patient has the feeling of, one, warmth. It's got a homey feeling. When they walk back into any treatment room, there's windows. We overlook the Metro Park. It decreases stress level. Some of the things we use in the office today that are different from 5 years ago, 10 years ago. It's called a cone beam CT scan for diagnosis. We actually can take a scan and three-dimensionally I can look and hold the patient's jaw and turn it and rotate it and look at it and dissect it before we actually would do any treatment. So we know exactly what can be done. That technology is invaluable in surgery today. Think about having the ability to get back and have your natural smile back, your natural function, being able to eat and chew a meal, being able to talk with people and not worry about something coming out of your mouth. These things are for quality of life. You can't, the patients, the responses I get are tremendous.
I don't have any pain with this. I'm able to eat all the foods that I want to eat, and by and large, I would recommend, or I would not hesitate if I ever had to have another implant done, I would have it done here.
I used to hide my smile and cringed when I see my teeth in the mirror. Now I just cannot seem to stop smiling.